Hello, I'm Noah Levine, Editorial Director for Dental Products Report, and this is your weekly dental update. This week we're jumping directly to our interview, where I was able to speak with UCLA periodontist Dr. Shervin Molayem about the paper he authored along with Dr. Carla Pontes, which will be published in the October edition of the Journal of the California Dental Association. In the paper, Dr. Molayem and Dr. Pontes present the evidence for a link between periodontal disease and severe COVID-19 outcomes. In our discussion, Dr. Molayem explains the reasoning behind their paper and the areas of research he believes are worth following in order to reduce the number of people who experience serious cases of COVID-19, as well as to improve treatment protocols to help patients from requiring ventilators. We discuss the connection between periodontics and systemic health. And now, we bring you my interview with Dr. Molayem. Well, Dr. Molayem, thanks so much for joining us today. I'd love if you could kind of tell us a little bit about this paper that you have coming up in the upcoming issue of the Journal of the California Dental Association.
Yeah, absolutely. So when the quarantine and the pandemic first started, I think it wasn't really difficult to see the connection, obviously, between COVID-19 complications which are inflammatory in nature and periodontal disease. And we saw the keywords, cytokine storm and IL-6, and these are the same things I talk about with my patients on a almost daily basis. I'm very focused on the connection between the mouth and the body. So my radar was definitely already ready to accept this. It just needed to be investigated, which is what this paper is. This paper really is a detailed, explanation. We're really connecting the dots is what it is. So the way that people are dying from COVID is from the cytokine storm, leading to this inflammation that's out of control. And eventually, especially IL-6 and CRP gets elevated. When IL-6 gets above 80 picograms per milliliter, the German study showed that's when people were having trouble breathing and needed to be put on a ventilator. So I kind of worked backwards. I said, okay, let's go backwards. We know why people are dying. Let's try to do whatever we can in the body to not let that happen, decrease IL-6, decrease the cytokine storm, don't let that kind of happen. And so we went back into the literature. There's a lot of literature already that exists with periodontal disease and IL-6. So we had to dig them all up, read them all through. And we found that, for example, when you do what's called a scaling and root planing or a deep cleaning, that we're able to reduce the IL-6 levels in the serum a great amount. So on average, you can lower it on average more than 3 points, 3 picograms per milliliter. And with CRP, you can on average decrease CRP greater than 50% in the serum. Crazy. So that, and that's for all, almost all these chronic diseases and inflammatory diseases, where we need to be focusing on the bacteria in the gum, because where's one of the dirtiest parts in the body? The mouth and the gut, and the foods that we eat and our saliva. And when we get dry mouth, it's all linked to the mouth. And it's one of the bigger openings of our body. And when you get this bacteria coming in, that's where all of the blood vessels are. You have a lot of blood vessels in the bone and in the gums and in the gingiva, as we call it. So that same blood vessels that are there are going to the foot in 1 minute. You have this heart that's pumping 60 times per minute, spreading all this bacteria. It also spreads a couple other things. These bacteria have toxins that they release, like LPS, MMP. These can break down collagen. They can break down bone. They do other harmful things. They also emit and cause, I should say, a host response from our inflammatory, from our immune cells like T cells, B cells, macrophages, to really release IL-6 and CRP, these cytokine mediators that set off a cascade of other IL-6s and throughout the body. Now, this can affect a few things. Number one, you have bacteremia. So literally you have bacteria going through the bloodstream. Number two, you have IL-6 cascade being sent throughout the bloodstream. You have endothelial cells in the blood vessels that are also releasing further IL-6. And what that does is it could affect the nitric oxide of the blood vessel concentration and cause interruption in the ability to dilate the blood vessels. That's the mechanism that we see with, for example, atherosclerosis. Mm-hmm. So that also is affecting, because when you have less blood flowing, you're not able to move. It's kind of like having diabetes or being a smoker. The less space you have in a blood vessel, the less flow you have to respond. Mm-hmm. Other pathways we see are aspirating it. So you just inhale and you're getting IL-6 that gets released into the lungs, which has been shown to do a couple of things. It will decrease the oxygen gas exchange in the lungs, and it also interferes with the proper lining of the lungs, the epithelial cells of the lungs. So, so we have direct, we have indirect pathways. We also have swallowing, another pathway. So when you swallow, there's a bacteria in the mouth called P. gingivalis, for example, mm-hmm. that can survive in the through the acidity of the stomach. And P. gingivalis is one of the bad ones. Obviously, it has the name gingivalis, gingiva, which means gum. But P. gingivalis is probably in the top 2 or 3 worst bacteria in the mouth, because it has the LPS, the lipopolysaccharide that it secretes. It has a lot of different weapons that it can use, but also they found it in the part of the brain that was linked to Alzheimer's. Yep. Mm-hmm. Last year, it was in a major journal, in the medical journals. Yep. So that's kind of where we looked at all the articles. We put it together. It's a pretty lengthy article. We're suggesting that there's a link. Yes. Until we really get in and do some clinical studies and create a control group, mm-hmm. really, randomized control study, we can't say obviously for sure, but we know that there's a strong link between, for example, pneumonia mm-hmm. and COPD and periodontal disease. So how are people dying from COVID? It's a lung, at the end, it's a lung disease, it's pneumonia. Okay, the studies that we have from periodontal literature, and again, periodontists are very good at their literature. We're in the mouth, we took upon the role of a mouth scientist in a way. When hospitalized patients, or when they get for example, deep cleaning, let's call it. Mm-hmm. But it's really called a scaling root planing. It means you're numbing and you're getting in. We're able to show an improvement in people's pneumonia, and be able to improve certain lung functions and lung capacity also, just by reducing inflammation in the mouth. So this is obviously we're excited to get the information out, because it was kind of talked about and hypothesized. This one, it took it a little step further and explains a little bit more detail. And we hope that this is just the beginning of further studies on this topic. Mm-hmm.
In terms of, immediate next steps, you've mentioned some of the things that could be studied, and, we all know that this type of research takes time to do it correctly. You mentioned setting up control groups. There's a lot to do. COVID is obviously active now. Are there things we know about perio and about treating perio that might be worth trying to help alleviate some of the serious effects people are having from the most serious cases of COVID-19?
Yeah, so I think there's two different ways to look at this. You want to obviously prevent and people and educate the people at home who can't get to the dentist perhaps, or not going in. So just regular oral hygiene and rinses. For example, there's a study recently that was published that shows that betadine or povidone iodine, when you rinse it for 20 seconds, it will kill all of COVID in the mouth, and you gargle with it as well. So of course you have to dilute it, and they, the viewers can look up that study, but that's tremendous, to be able to do that. I think when you get to, and of course brushing and flossing and seeing your dentist or possibly a periodontist, because gum disease is a silent disease. There's only 6% of them people have pain, so most people don't know that they have it. And you need sometimes x-rays taken and a good complete probing. Probing means that there's an instrument that goes underneath the gum that measures how deep the gum line until where it stops. So it's the attachment. It's not necessarily till where the bone is, but it's where it stops in an attachment. We want that space to be always less than 5 millimeters. The reason is because the studies show that up until 4.5 millimeters is how far deep a hygienist or dentist can predictably clean. So my goal, and you had a great point, is what's next. I believe that we need to be, as also medical doctors who are listening, to be more in tune and kind of keep your eye on people's mouths and examine it possibly, because we need to say, okay, open up, look to see how the gums look. Are they red? Is it a glassy appearance? Sometimes glassy in the margin of the gums, it means that it's inflamed. It won't be as pink as the rest. The areas that mainly this happens to are in between the teeth. We have to ask certain questions, such as, when you floss, do your gums bleed? Now, when you floss is the question. Only 30% of people actually floss. And of the people that say they floss, 30% of them lie to dentists. So we have a good amount of people not flossing, basically. And regularly. So that's another issue, but we have the elderly, we have people who are in nursing homes, we have people who are in hospitals that have inflammation in their gums. Because if you really think about it, how many people actually have gotten a cleaning in 2020? Not too many people. And it's understandable, because we had some shutdowns and people were scared to go to the dentist, and people were scared to leave their house. And so offices were closed. So we know that that aspect is happening now more than ever. Hygienists were very late to come back to dental offices as well. Because as doctors, we have our own chats and Facebook groups and outlets where they communicate. Hygienists had their own and said, whoa, we don't have enough PPE to work. We have that little machine, the ultrasonic that goes zzz, water's flying everywhere. We can't really clean these heavy cases of tartar with our hands without that machine. So there was a sense of panic that we noticed in the dental community as far as hygienists, and rightfully so. You have this unknown disease, an unknown opponent, and you have to be cautious. So now they're starting to come back in the past month or so, but there's a backlog of patients that want to get in. And so there will be studies on that as well that show that the demand for hygienists has increased. Let's say, for example, you had a hygienist who was coming to an office twice a week, and they may be a part-time hygienist, or they have kids and they're raising a family or whatnot. They said, you know what, it's not worth it for me to come in 2 days a week, risk, So we're really seeing people's mouths dirtier and bleeding gums and and it's not just myself saying it, it's noticeable. So this is an issue. It's a timely issue. We can decrease inflammation in people's bodies, not just their mouth. We need to also educate our patients on other ways to decrease inflammation. We need to let them know that COVID death is an inflammatory pathway.
Yeah. In terms of, what you just talked about with both educating the public and making sure that people are taking, the proper oral care steps that they should be on a day-to-day basis, the World Health Organization just came out with a statement the other day about dental practices being sort of an unknown commodity. We don't know about transfer, even though the statement mentions that they don't know of a confirmed patient to clinician or clinician to patient transmission, but they recommended not going to any sort of, elective procedure, to which they also included your standard prophy appointment. I know the ADA today issued a response saying, they think this can be done safely. Where are you seeing this? Is it important for dental practices to be open for those routine checks so that we can catch people who are having periodontal disease in the earlier stages?
Absolutely. The answer lies in the data. So until we see actual proof of that happening, I don't see it right now being any truth to it, because in the dental office we're wearing N95 or KN95. Most of us have another mask over that, a face shield. We're walking around the office. The only place we could really take it off our masks or hiding in the office like I am right now. So now if a staff member from an office ends up catching COVID because they were at the weekend and they were out with friends, now that's a different story than actual transmission or catching it in the dental office, which there are no reports really of that. So until I see reports of that, in life, sometimes things aren't just one side or another. You have to balance, and that's the art of being a doctor and a scientist, is to really see the balance. And the balance is, on one end, sure, obviously you want to reduce risk of catching anything, and then you have also the risk of inflammation. So which one is it? Now, if you're pretty good about keeping your mouth clean, so now we have to get into okay, how do we calculate this? Certain people have higher risk. The elderly have a higher risk of inflammation. So just by, for example, if you were to look and see which people, again, go back to everything goes back to the how do people die? IL-6 above 80, go on a ventilator. Of the ventilator, only 30% are surviving or so. So how do we prevent that? We got to keep IL-6 down. How do we keep IL-6 down? So anti-inflammatory diet. So sugar, not the fruits, but processed bad sugar and processed carbohydrates increase IL-6. Also, obesity increases IL-6, and diabetes and cardiovascular disease. And what do you know? I just named everyone who's at the highest risk of dying.
Yes.
So elderly, just by being older, by definition, there's more IL-6 being released and more inflammation. So we have to do whatever we can. Turmeric, ginger, garlic, onion. You're exercising. This is the time when people need to know, okay, this is, also some certain meats are inflammatory. There's, chicken, red meat. So we want to keep, more of a plant-based now more than ever for that particular reason as well.
Yeah. Now I know that, there have been some periodontal susceptibility tests that are genetic tests that can tell, are you more likely to get periodontal disease based on your genetics? Do you see that there could be a use for those in determining who might get more serious outcomes with a COVID-19 infection?
I love this question. And
Mhm,
actually, we have a whole section in our paper which we talk about this.
mhm,
I myself, I do a lot of genetic testing on my patients, and it's a salivary test. Basically, they spit in a test tube. We send it to the lab, and I check to see what types of periodontal pathogens are in their mouth and at what levels, if they're over the threshold. Also, we can find out what their alleles are for certain factors, such as IL-6, IL-1, TNF alpha. We can see what their alleles are.
mhm,
What I've been seeing is people that have a high risk. So if you're a high risk for IL-6, that means I'll get the paper back. It'll say GG,
mhm,
high risk. If you're GC, you're medium risk, and if you're CC, you're low risk.
mhm.
So if, for example, you're GG, you have to be a little bit more on top of it, because the cytokine storm, again, this is a theory. This is not, I would love to do a test on this. If anyone is listening to this and would want to reach out, I have some ideas of tests that I want to do, but obviously I need help. But that would be great, because then we could find out, everyone would know if they're high, medium, or low. And that basically would possibly say if your body is a type that might do the spiral out of control a little bit more than someone that might be able to handle and accept an intruder like this virus.
Mhm.
I see that people that have this high IL-6 risk, the GG, they have a higher percentage of periodontal disease. They have, not only, this is published, by the way.
Yes.
Yeah, this is not unknown. They have a higher risk, but also they have this other cofactors. I'll notice, I'll be like, okay, you have 7 millimeter pockets. We need to do this gum procedure, and you go back to their medical history, and you're like, lupus, arthritis,
Mhm.
all these other chronic inflammatory diseases that
Yes.
are IL-6 related.
Mhm.
So it's interesting, because there's a new treatment now that is being done in many hospitals, and that's an IL-6 antagonist,
Mhm.
such as tocilizumab. That's an
Mhm.
arthritis medication already available, relatively cheap, and they're giving it to the patients, and patients are responding well. They're seeing in the studies a 90% recovery,
Mhm.
which is amazing. Obviously, we want to get to as close as 100 as possible, but it's a good start. And just because one is 90%, it doesn't mean you can't do that plus dexamethasone plus a
Mhm.
couple of others and try to get closer to 100. But something really interesting also that I want to say, that's a little bit controversial. Hydroxychloroquine,
Mhm.
in a study, again, the best studies are simple studies, because you're not getting too complicated. This study showed that hydroxychloroquine, by giving it in a control versus a population that got it, they checked their IL-6 levels before and
Mhm.
after, and they saw on average it dropped from 22 picograms
Mhm.
to 5.
Mhm.
Amazing.
Yeah.
Because we have to, again, I'm not for it or against it. I'm not getting into the politics of it. As scientists, we need to talk about the science and the data.
Yep.
Is it safe or not? I'm not the person to say if it's safe or not. I have my own idea possibly, but my idea doesn't matter.
Mhm.
But I'm talking about that lowers, if IL-6 is the pathway to being on a ventilator, and hydroxychloroquine can lower it from 22 to 5.
Mhm.
Wow, that's a lot. And then if someone has gum disease, it could lower it another 3 or 4 points, and then a couple of other treatments. let's keep this thing from spiraling out of control. Let's test their genetics. Let's see if they're high susceptibility, medium, or low. You know, these are all different solutions that we got to be thinking about, because I think that even though this pandemic, I think we're nearing the end, and we're definitely I think the worst is over with, but we're still seeing death. But I think in the next 10 to 12 weeks, we're going to see this kind of fizzle out a little bit, because of I think herd immunity is going to kick in because of the T cell immunity that we're seeing. I think more people are possibly have gotten it and have this T cell immunity than we think. So we have to wait for studies on that. But and that's the same concept and idea behind the fact that kids aren't getting really sick off of this, because kids already get a lot of coronaviruses. Their bodies already have this T cells ready and available, and they're constantly, their T cells are what's fighting. Now, people, when as we get older, it takes a couple days for this T cell to be made and to come, and the CD4 and CD8 cells to come. So, and the older you get, the more time it takes to go through those blood vessels to be made and be sent, and so kids, it's there. They can get it before it progresses. And one of the things with COVID that's really important to keep in mind is the speed at which we treat it. So the sooner we find out we possibly may have it, and the sooner we do something about it, the chances of us not going down that pathway is much less. So, and what are some things that we could possibly be doing is, and again, I read up on this stuff, but this is for more of the experts on the medications and the medical doctors who probably know more than me on this, but they're looking at also nebulizers as being really, really key, because especially with steroids and the budenoside, for example, you get these corticosteroids that you're breathing in, you're inhaling, you're breathing in, it opens up the bronchioles, you're also, decreasing inflammation locally. So that is also, there's a lot of research being done on that as well that's promising. And that is a concept basically of, let's get it before it spreads. Let's get it early before it spreads down, because it comes in the nasopharynx, it goes down to the throat, and then it makes its way down to the lungs. So that's where you want to catch it. It just, again, sometimes we just got to go back to common sense, and sometimes common sense doesn't make any sense here. Because, and yeah, go ahead.
Well, I was just going to say, periodontists have kind of been at the forefront of bringing the dental field back into more of the main medical field and connecting to systemic conditions. And it seems to me that COVID is proving to be not just another case, but a case that can really help to kind of put oral care and gingival care at the forefront of people's minds. Do you think that this is an opportunity for that messaging to get a bigger megaphone, to be reaching a bigger amount of people?
Absolutely. I think I love your questions, because you're really, it shows that the thought process is in the right direction. Because one of my issues that I've been seeing is, and for all the doctors that are listening to this, is that the dentists, we go to the dental school, and the doctors, they go to medical school, and that there's really, this separation. Up until, then you get the oral maxillofacial surgeons come back into the hospitals, and then they interact with those. But they're just, they're doing trauma and, more, cancer related possibly, and putting out the fires as far as more of trauma. But when it comes to oral health, it is an integral part and part of the body. It's an integral organ that is connected to everywhere in the other organ. So I think it's time that we kind of converge, and I think this is a good forum, and this is a good time. I would like to also, I'm reaching out to hospitals actually right now. So I wanna go into a hospital myself, and I wanna examine people's gums that are that put on a PAPR, go on the front line, and and I want to step up to the plate as well, so I can see, because I'm not there. There's only so much I can get through the literature and the papers, and so I want to see what's going on. I want to conduct my own study and see if we can lower IL-6 levels after this deep cleaning, scaling, root planing, possibly a gum surgery, possibly a root. By the way, it could also be a root canal gone bad. It could be a root tip. It could be other types of infections in the mouth that are kind of less obvious with a probe. Those also show to have IL-6 as well, and you need an X-ray to really see those, or even a CT scan might show some of those.
Yep. Well, Dr. Molayem, I really appreciate you joining us today. We're just about out of time, but it's a very interesting paper. I think you raised some really good points about this connection, and I'm looking forward to seeing further research in this area, because I think if we can help people improve their health of their teeth and their gums, we probably are going to help people improve their overall health all across the board.
I agree. Thank you so much. Thanks for sharing this message with everyone as well.
We'd once again like to thank our guest, Dr. Shervin Molayem, for joining us on today's broadcast. This wraps up our weekly dental segment. Now we turn things over to Matthew Gavidia for news from the Center for Biosimilars.
Great updates. Thanks, Noah. And now we have news from the Center for Biosimilars with Matthew Gavidia. Take it away.